When it comes to medicine, doctors and scientists are constantly creating and improving on treatments to create a happier and healthier society. This video will highlight some common treatments that were once believed to be effective, but further study has shown their risks may outweigh their benefits. Hormone replacement therapy. Hormone replacement therapy, or HRT, is a medical treatment that was commonly practiced in the 1990s. This treatment aims to alleviate symptoms of menopause, which is the time that marks the end of a woman's menstrual cycle. This treatment was thought to be effective as the original studies were done on mice, mares, and foals, and scientists saw a protective effect on their heart and bones. In 2002, the Women's Health Initiative conducted a study and found that HRT increases the risks of breast cancer, heart failure, and stroke. This knowledge led to millions of doctors to stop prescribing HRT and promote acupuncture, dietary changes, and increased amounts of exercise. Keyhole surgery for osteoarthritis. Osteoarthritis is the most common form of arthritis that can damage any joint in the body. It occurs when the protective cartilage on the ends of bones wears down over time. In the early 2000s, doctors would prescribe keyhole surgery for this condition. This is when a patient would be placed under anesthesia while cameras and surgical instruments are inserted into a tiny incision and would smooth or remove cartilage that was irritating the joint. A 2016 medical study conducted at McMaster University concluded that keyhole surgery does not show any more advantages than weight loss, physical therapy, or painkillers for osteoarthritis. Vertebroplasty. In the late 2000s, vertebroplasties became a commonly used treatment for osteoporosis, which is a disease that causes low bone mass and deterioration of bone tissue. This treatment involves a medical cement being injected into one's vertebrae that have been cracked. Several studies have concluded that this procedure is purely a placebo, meaning it does not aid the body physically, but the patient psychologically feels better. Pre-implantation genetic testing. Many women above the age of 35 who are undergoing in vitro fertilization, when an egg is fertilized by a sperm outside of the body, are recommended for pre-implantation genetic testing. This is when a few cells from an embryo are tested for more than 100 genetic conditions and any chromosomal abnormalities. A study of 206 women with genetic testing and 202 without showed those who had genetic testing had a lower successful live birth rate.